Good afternoon. You're listening to the new WCEG Network on WCEGTalkRadio.com. Click the live stream tab or watch us live on your smart TV. YouTube at WCEG Network. I'm Celeste Giordano, your show host, along with my co-host Sara Poe. We're the global legacy and wealth building in this new economy. We're the worldwide community empowerment group where we speak life into the community. Like us on Facebook, follow us on Twitter, and on Instagram at WCEG_talk_radio and at WCEG Network. Last but not least, our disclaimer, the topics and opinions are those of the show host and guest and not WCEG Network. Thank you for your continued support. Well, hello, Miss Sara. How are you today?
I'm great.
How about those Braves?
Yes, I'm ready.
I'm telling you, we've got a great show lined up here today, and we are glad to have Miss Bonnie Dobbs back with us with Medicare and other red tape. As we have always said, Sharita was the queen of grant writing. Bonnie Dobbs, you are the queen of Medicare. So we are grateful to have you, and we are very grateful for our show host, our sponsors and WCEG Network, Penny Rogers, and the board for allowing us this opportunity to serve the WCEG Network community. Sara and I both love serving the community. We love bringing on amazing guests like Bonnie Dobbs and many other people that we've had that we can educate and inform the community on how they can grow their business so they can learn, grow, achieve, and prosper and leave a legacy for their loved ones. So anyway, Sara, tell us a little bit about you if you don't mind. Tell us about Poe's Accounting Services. Tax season is like over as of October 15th, so to speak.
That's right. So I'm Sara Poe with Poe's Accounting Services. We do taxes, bookkeeping, payroll, just anything a small business would need. That's what we're there to help. I like teaching, I like informing and making sure they're all up to date and they don't have any red flag issues. So we'd be glad to help you in any way possible.
Absolutely. I appreciate that. And I am Celeste Giordano. I'm a master sales strategist and a business mentor. And I help business entrepreneurs, direct sales teams, and medium corporations exponentially increase sales and profit through lead generation, building relationships, and accountability. And tonight, Sara, we have the amazing Bonnie Dobbs with Medicare and other red tape. And just like to tell you a little bit about Bonnie. Our title tonight is going to be Medicare, What's New for 2022. And wouldn't it be great if we could find someone who truly understands the Medicare process? You know, I just turned 65 and I know that process. If it wasn't for the help of Bonnie, it just drove me crazy. But Bonnie is someone we can trust to help us make this important decision with a free consultation. Our guest speaker will be Bonnie Dobbs, founder and owner of Medicare and Other Red Tape, LLC in Atlanta, Georgia. Just after obtaining her insurance license, a member of Bonnie's family developed Alzheimer's. Yeah. While visiting him in the memory care facility, Bonnie found families were very confused about Medicare. She chose then to specialize in Medicare and has become an eternal student dedicated to helping the aging community. This has opened opportunities to share her knowledge and thousands of people through classes, seminars, workshops, and panel discussions. Bonnie has written articles for Ask the Expert in the Atlanta Journal-Constitution and is the Medicare expert that sits on all the AJC's Aging and Atlanta panel discussions. As brokers, Bonnie Dobbs and her team are contracted with all major insurance carriers and probably some we've never heard of and are active in multiple states. So we would just like to thank you, Bonnie Dobbs, for being our guest. This is the second time Sara and I have had you on the show. And, you know, it's Medicare time right now, right?
It is. It's that time of year.
And so is there anything that you would like to share with our audience that maybe I didn't share in that and reading that bio?
Well, yeah. So right after I got my license, my ex's father developed Alzheimer's. And so they actually lived directly across the street from the nursing home and memory care. So every day I would go over in the afternoons to see him. And every time I went over, people were always so confused and talking about Medicare. Well, I just had gotten my license and I was like, well, why is this so confusing? And one night, whenever we came home, Helen, we were sitting at the table and Helen said, I really don't understand this Medicare thing, because some people say that they get nickel and dime to death. And some people say that they make a monthly premium and then everything's covered. And then Mason and I paid nothing. And I was like, yeah, you're right. This Medicare thing is confusing. Nothing makes sense. It's not consistent, right? And so I got to learn firsthand that the people that felt like they got nickel and dime to death were on a Medicare Advantage plan. The people that paid a high monthly premium were on a supplement plan. And the reason why they didn't have to pay anything is because he was TRICARE. And so his medical and medications were basically, everything was covered. So I'll get into the weeds a little bit more about our specifics about Medicare Advantage and supplement plans later on. But that was my introduction to it, is seeing it firsthand, how everybody was so confused and it didn't make sense to them and it didn't make sense to me either.
Absolutely. Go ahead, Sarah.
I know that I've got clients that come through here and, if they're 64 and whatever, and I say, you do have someone that you can go speak to about Medicare, because at 65, you have to sign up for it, whether if you take it or not, right? And I said, because I can't help you. I get confused. It's not my bailiwick. So, I'm looking forward to be able to pass out your name this coming tax season.
Well, it is very confusing, Sarah and Bonnie. I mean, I don't know how many times I made a phone call into the Social Security office, and, it's like anything else. You can talk to 10 different people and get 10 different answers. And then you're like, who do you trust? Who do you know? But not everybody's scenario is the same. Correct. And it is a case by case thing. And so again, it's try not to do this on your own. You do need to get with a recommended person. We have our recommended person as Bonnie Dobbs, but you need to get with somebody that can help you and walk you through and guide you through this, because it can cost you a lot of money if you make some wrong mistakes. Is that right, Bonnie?
Absolutely. There are penalties. And in the Medicare and You book that comes out every year, it says penalties are for as long as you have Medicare. Well, how long are you going to have Medicare? As long as you live, right?
Right.
So that means once a penalty has been incurred, you're going to have it forever.
Oh God, I didn't know that.
Yeah, yes. It's ugly. And there's lots of different reasons. It's like if you don't enroll on time, or if you ever enroll, then disenroll, they're very specific timeframes for that. And then there's a late enrollment penalty for Part B, as in baby, and also for Part D for drugs. So while we're on that subject, though, the penalty for Part B, as in baby, is 10% for each year that you don't have a plan, a Medicare plan, or that you're not enrolled in Part B, rather. Okay, let me clarify that. For each year that you're not enrolled in Part B, once you become Medicare eligible, then you get a 10% annual penalty. For the drugs, the Part D, that is 1% of the national average for each month that you don't have one. So I had somebody call the other day, and he hasn't had a drug plan ever. And his monthly premium is going to be $25 and some change every single month once he gets a plan. So, and that's going to be for the rest of his life. Well, $25 doesn't seem like a heck of a lot, but if he had enrolled on time, he could have saved himself that much money, because he's only been Medicare eligible for maybe 6 years or something like that. I'm not exactly sure the amount, but Yeah, so it's very important to know those timelines. And that is one of the things that we help our clients with, is to avoid a penalty, make sure they also have continuous coverage. So you don't want to find yourself without coverage. And a lot of people will say, well, I have 3 months after my birthday to get a plan. Well, that's great. You may have 3 months after your birthday, and you're absolutely right in saying that. But what if something happened during that time? You know, it may not always be medically. I mean, you know, maybe you fall down and break a bone, or you're in an automobile accident, or, you know, any number of things. I mean, we don't get insurance hoping something will happen. We get insurance in the event something happens, right? So yeah, so those timeframes are very important to know.
Well, you know, since you just brought up penalties, I have a question.
Sure.
So if you sign up, you know, you turn 65 and you sign up for Medicare, and you have a policy because one of your spouses is working, and you just sign up for, what is it, Part B for the hospitalization, or is that Part A? I don't know.
I'll go over the alphabet soup a little bit, a little bit later on. Yeah.
Right.
But to answer your question, yeah, this is kind of out of sequence, but let me go ahead and address that question. Okay.
Yes.
So if you're turning 65, you have the 3 months before your birthday, the month of your birthday, and 3 months after, excuse me. Now, that is dependent on you not having coverage through an employer or a spouse's employer. If you do have coverage through a spouse's employer or yours, as long as that employer has 20 or more employees, then you can, you don't have to enroll in your Part B immediately. You can delay it until you're going to lose your employee coverage. Okay. But the keynote here is they must have 20 employees or more, because they have to have Medicare equivalent insurance. Otherwise, you would get a penalty. So thank you, Celeste, and your husband for calling and consulting with me on that, so I could make sure that you got the right answer so that you guys will not get a penalty. Exactly. Now, whether you're turning 65 or retiring after 65, I always like to start working with people about 3 months before, okay? Because that gives me ample time to get all the information that I need from you, to give you guidance on how to get enrolled in the different parts of Medicare. We always provide a special one-on-one class for our clients to tell them about Medicare, how you get it, what it costs, how it works with your plan, because I never want to enroll somebody in a plan and they don't understand it. Now, they may not be able to stand up and recite what I say, but at least they're going to have a good understanding of it. And I always show them exactly where they can go to find their information as we're going over it. And I think that's very important, because it is so much to learn and to remember at once that there is no way anybody could do that. So I just try to put things in simple terms. And that was my goal right from the start, because I saw how confused everybody was whenever I was going to the nursing home, or then whenever later he was put into memory care. I didn't want to talk in terms like if you call the federal government, or if you read a federal government generated document, or even Medicare and you, because that, they speak their language, or they put it in a way that's not plain English, so to speak. And that's what I try to do. I just try to break it down in as simple terms as possible.
Yeah, because I mean, I can read IRS documents to people and their eyes will just glaze over. They don't get it, right. It's too hard. So yeah. I have to take it and make it mean plain English, and you're having to do the same thing, because when you work with these government agencies, they're so big, they're red tape, just like your part of your business name is. It's crazy. It's just outrageous.
It is. And it's not like everything is put in a format and it's like a 1 page, something that you can easily read. There's like 200 and something pages, and it's not consequential. It's like this and this and and so you have to have a good understanding of the whole program to be able to pull the specific information that whenever somebody asks me a question. So, and I try to say it so that they understand the answer. So am I doing okay so far? Let me just check in with you guys.
Yeah.
Oh yeah.
Absolutely. And, adding to what both you and Sarah just say, Sarah, from a CPA standpoint, talking about the federal government, and you talking about Medicare and everything, so many people pick up the phone, they call Social Security, and those people are scripted and they're limited to what they're going to say to you. And if you're already lost and you call them, you're not going to get the whole truth, nothing but the truth, so help me God, from them, because they don't know. And that's
true.
And that's why it's so important to have somebody like you, Bonnie Dobbs, in your corner that can guide you and walk you through this, because you can sign up with this Medicare through you or through online, correct? We don't have to call Social Security office to do it.
No, as a matter of fact, what I was going to say is it really, really irks me whenever somebody said they call Social Security or they called Medicare. Those people are not insurance agents. They don't have all the training. They don't know the plans. I mean, I can just start talking to people about their plan. And because I do this every day, all day long, okay, hundreds of thousands of people that I talk to, okay, it's like, I know which plan you're on, and I kind of know which plan you probably need to be on just by a general conversation, but we don't stop there. We have a form that we call our discovery form, and it's 2 pages long. And you complete that form, and it gives us more information and specific information so that we can research and compare every single plan that is available to you in your service area. So that once we get that, then I always have more questions, and I call the client up because I want to find out what's important to you. What are you looking for in a plan? And today I spoke with a guy. He's got a father who's 95 years old in a nursing home. That client is going to have different needs than another client that I spoke to. And he and his wife were getting ready to go out of the country for a month. Okay. Mm-hmm. So you have to find out people's lifestyle is such a big component. Yes. It's not just a couple of things. And those people, if you call Medicare or Medicaid, Medicare or Social Security, or even if you call one of the insurance companies direct, they're going to enroll you in whatever they have in their portfolio. Okay. We compare all of the companies and all of the plans. So whenever you're using us, everything has been, we've left no stone unturned to try to find the best plan for whatever your needs may be.
Well, and what happens also with, you call your insurance company and automatically they're going to encourage you to go sign up for the Medicare or Medicaid, whatever plans they have. So they're not charging them first. You're charging the Medicare first before you charge the insurance company. True or false?
I think you're talking about a specific plan, a specific way of getting coverage, and I'll go over that later. But Whenever you call a specific company, they are going to write you in whatever plan they have in their portfolio. Okay.
Right.
And there's some companies that only offer Medicare Advantage plan. Well, a Medicare Advantage plan is not the most ideal plan for everybody on the planet. There's some companies that only offer Medicare supplement plans. Same thing goes true. Not everybody needs a Medicare supplement plan. So whenever you call one of these companies, you know, a layperson, you're not going to have any idea what they offer. Okay. I mean, I know it right off the top of my head, all of the major companies, and probably, like I said, some you never heard of before, you know, but yeah, so calling a company direct or calling somebody from Social Security or Medicare is not the right answer.
Yeah, because
Absolutely.
they're not going to dig down into all the information to get you the right stuff. I see that in taxes where, you know, I ask a lot of generic questions starting out so that I can pinpoint going further in, looking for the information. And you've got to start out like that. And, you know, one thing's always asked, so what's happened this year? What in your life has changed? Because that may give me an idea that they have no idea about.
Correct.
That's true. That's right.
Correct. And the more questions you ask, I always tell every one of my clients, the more information that you give me, the better I can help you.
Yes.
Absolutely. You know, and coming from a business master strategist here, you know, I always encourage all my clients that you need to have what I call the 5 wise men, 5 wise women, whatever you want to call them. You know, you want a CPA, you want a banker, you want an insurance representative, you want a financial advisor, you want a lawyer, and you need to have a relationship with these people. And it just amazes me today, the people that don't have relationships with these people, other than they're going to go into some CPA firm, Sarah, or they may go to HR Block or whatever, or this insurance, and they don't have a relationship. So they don't know that these people don't have their best interest. And if you have a relationship with these people and they know a little bit about you, and it's not a one time that you're shopping with them, you know, they're going to have your best interest at heart. And I just can't stress that enough, of having that relationship with those people.
Celeste, that is great advice for everybody across the board. That is really good advice. And you're right. Everybody does need to have those 5 people, and they need to have relationships with them, because that's when they're going to have the best outcome. Whether Sarah's doing their taxes, you know, or I'm doing their insurance, or an attorney is helping them with power of attorney or wills and all of that pertinent information that is so important to seniors.
You know, it is. And I'm very fortunate that, speaking of me personally, is that, you know, I've had the same CPA for 43 years. I've had the same attorney for 30 something years, Mike and I have. And we have those relationships. It's like, if we need something, we don't have to say, Sarah, who do you know that I can call? I need a lawyer. Or who do you know that I can call? I need to speak to, I'm turning 65. No, you know, we have that right there. And
Right.
They're our go-to. We've vetted those people. And this is why we're so glad to have you back with us, Bonnie. You are the queen of Medicare and other red tape right here. So you got a new name from me and Sarah. You're the queen of Medicare.
Well,
Sarah,
thank you. I will graciously take that.
And I'm going to get you a crown and bring it to your office so you can put it on your.
I'll put it right beside this wonderful flyer that you all made. Is that okay if I show everybody this?
No, absolutely.
I do so much speaking on, whether it's panel discussions or radio or podcast or churches, whatever. But when you guys sent this, I actually put it in a stand up to put it in my office. I think somebody over there did a really good job. So thank you very much. So when you come in my office, you'll see that.
Absolutely. And we want to give credit where credit's due. And Debbie Kerr of Plan B is my admin and does a great job. And she's a graphic designer. She's a publisher if you got a book, and she's an amazing lady. So we're very, very grateful for her.
Thank
All
you,
right,
Debbie.
Sarah, you got some questions for Miss Bonnie.
Yeah. So I know that you're an Atlanta Journal-Constitution experts panelist on Medicare. There's so many different commercials on Medicare today, all promising low rates and great benefits. How would I choose?
Oh, don't you love those commercials? You may be missing out on dental, vision, hearing, gym membership, we come over Tuesday night, cook your dinner, walk your dog, a trip to Disney, you know. Are you getting that 148.50 back that's due you, you know? So all of these make everybody so confused. And if you watch something on TV, like especially during COVID, everybody was sitting home and they were binge watching. Okay. So certain programs that are geared towards seniors, you know, at every commercial, you got Joe Namath on there, by golly, saying all that, or you got JJ Walker, or, you know, some other celebrity or someone speaking about it. And you start questioning yourself. Well, am I really missing something? Let me tell you, first of all, to get the 148.50 back, you have to be low income. So if you're single, you make like under $1,000 a month, or married, filing joint is probably around $1,500 a month. And you can only have like $2,000, $3,000, or maybe $4,000 in savings. Then yes, even I can get you that 148.50 back. Okay. By the way, every single plan that they're talking about, you can get it right here in Medicare and other red tape. Okay. We have them all. Okay. But we tell you the truth about how you qualify to get it and who qualifies to get it. The other thing is, what you don't see in the fine print is it says, we are not an insurance company. We're not an insurance agency. We are a marketing firm. And when you call our 800 number, an insurance agent is going to answer the phone and help you enroll in a plan. Oh man, doesn't that just kind of spoil all the fun that you had fantasizing about getting $148.50 back and free transportation to God knows where? Okay. So when you hear those commercials, you know, just go, oh, now I know the rest of the story. Now, there are many plans available for that do offer dental, vision, and hearing, and gym membership, over-the-counter medications. This year, some of them started adding food cards, which if you are low income, those food cards, I think in the state of Georgia, range from about $30 to $100. So if you're low income and I could put you on a plan getting one of those, of course, I have just done you a big favor and maybe help change your life so you can get some things that you would not have ordinarily, you know, been able to get. And then the over the counter, this is so important, because people who need Depends, and I know usually people laugh about that, but really it's not a laughing matter. Okay. If you're on limited income and you only have enough money for one packet of Depends, and you all of a sudden can get $100 or $200 every quarter in over the counter, and you can order yourself Depends, I've just changed that person's life.
Yes.
And that makes me feel so good. And that is one of the main reasons why, another main reason why I got into this is because I can help people get benefits that they were not even aware of that was available. So whenever you see all those crazy commercials, just think, yeah, there's always a catch to it and something in the fine print. And now you guys know the truth.
Absolutely. We have a client, I should say, a customer that has a question that says, do you have to have private insurance when applying for Medicare?
Okay. Well, that depends, of course, on when you become Medicare eligible. So if you are under, and there's 3 times whenever you become Medicare eligible. Number 1 is if you're under 65 and on disability. Both the federal government and the medical industry agree. If you have not rehabilitated with it within 24 months, you're probably not going to. So in that 25th month, you become Medicare eligible. Okay. So it doesn't matter if you have insurance prior to that 25th month or not, you will not be penalized. But in that 25th month, you do become Medicare eligible. The second time, is when you turn 65 and you do not have employer or retiree plan. Once again, you have 3 months before, the month of, and 3 months after. If you are working past 65, you must have credible coverage through either your employer or spouse's employer that's Medicare equivalent, and then you can delay it. But if you're past 65 and you do not have any insurance, then you are going to get a penalty. Did that answer the question?
Well, I'd like to think you did.
Okay.
So, Bonnie, what are some of the most important changes you see coming in 2022?
Well, let's start out with some drug plans. So this year we had one company, and they have 6 drug plans for 2021, and they are going to combine those down to 3 plans, which will make it easier. However, it is a little confusing for enrollees that's on one of those 6 plans, because some of those plans are going like from $30 to $60. Some of them are going from like $19 down to $12. So WellCare is the name of that company. So if you're on a WellCare prescription drug plan, okay, you want to make sure that you get that plan reviewed, or get your, not that plan, excuse me. You want to get your medications reviewed to see which plan that you're on, because you may be getting your monthly premium increase just because the plan you're on, not because of the medications that you're on. And we're all about saving people money. So that's one thing. Also, Aetna bought Silver Script this past year. So Silver Script is actually offered in every state, including Washington, D.C. And their rates, this is crazy, this rarely happens, but their rates on some of their plans have actually decreased. So regardless of which plan that you may be on, okay, some of the monthly premiums have increased, some of them have decreased. The donut hole thresholds now are $4,330. If what your copay and the insurance company's copay adds up to $4,330, then you go into the donut hole. In the donut hole, you'll pay 25% of their negotiated rate. Now, whenever you see a co-insurance, and that's what a percentage is, okay? So co-insurance is a percentage, not, and copay is a definitive amount. But if you see a copay, it's their negotiated rate, not the full cost of the drug that you would see on the internet. So in the donut hole, once again, this year, you'll pay 25%, whether it's brand or generic, until you've paid $7,050 out. So those two figures around the donut hole are having an increase. Last week, they just, the federal government just released the Part B premium and Part B deductible for 2022. So this year, the Part B premium is $148.50. They're going to have a $10 increase to $158.50. And the deductible for Part B this year is $203, and they're increasing it up to $217 for next year. So those are some of the actual costs that have been released by the federal government so far.
I've got a question for you. And
Yeah, sure.
It's kind of off script, but you know, those gold RX cards, right? You know what I'm talking about?
Yeah.
Okay. So if you've got Medicare drug plan, can you use that too to get it even lower when you pay for your prescriptions?
God, I'm so glad you brought this up. Okay. So you have to have a drug plan so that you don't get a penalty, right?
Right.
Don't have to use it. Okay. So let me say that again. You have to have a drug plan, but you don't have to use it. So I always encourage everybody to find out how much it is if you use your drug plan but also ask the pharmacist, how much would it be if you did not use your drug plan, if you used GoodRx? And every day, I mean, I just had one of my clients tell me that he can get many of his medications cheaper through GoodRx than he can through his drug plan. And if that's the case, by all means, buy your meds wherever you can save money. I would like to add to that too, Sarah. If you're on some really expensive meds, like meds that cost $5,000 or $43,000 a month, or some of these really new medications, nobody can pay that amount of money. So you can call the pharmaceutical company that makes that medication and ask them for a coupon, or if they can supply that for free or for a very low cost. And usually you get it.
Absolutely.
Well, that's good to know.
Yeah, that is good. That is good to know.
Well, I'm going through something with our insurance company right now, where there's a couple of prescriptions that I take, and I only take name brand. I don't do generic because I only have one kidney. And so they're saying that I cannot take that anymore unless the doctor, sends in a thing and prescribes that. So today my doctor called me back and said, one of the prescriptions that I don't, it's for thyroid. It's a Synthroid that he can get the medicine directly from Synthroid for me, as opposed to going through my insurance company, for literally nothing.
That's the right answer. That is the right answer. And thank you for bringing that up, because oftentimes your doctor also can provide samples for you, or they have a way of interacting with these pharmaceutical companies to get you a discount, or to get it at no cost. So what you were referring to that your insurance company was doing is something called an exception. And there's a formulary exception, and there's a tier cost exception. So a formulary exception would mean that the doctor would put you on a drug, and that drug would not be in the formulary, because whenever we're researching drugs at this time of year, we can only research the medications that you're currently on. We're not genies or psychic. We don't know what you may need, a month or 10 months from now. Okay. So if we put you on a plan, and in that plan, later in the year, your doctor puts you on a drug that's not in there, then your doctor can ask for a formulary exception. And the same thing holds true with a tier exception. If your drug, say, is a tier 4, and that's just totally out of your budget, then your doctor can request the insurance company for a tier reduction or tier exception, and then they would possibly put it down to a tier 3. The other thing is called step therapy. Now, all of these drug plans or advantage plans, they have these same rules in it. So step therapy is an example. Say your doctor puts you on a drug, puts you on Synthroid, okay? That's a good example. And the insurance company says, okay, but let's try levothyroxine first, okay? Because Synthroid is brand really expensive. Levothyroxine is generic, very inexpensive. So the doctor puts you on levothyroxine, and either you have a reaction or the medication just doesn't work. Then they will step you back up and give you the Synthroid. Now that's called step therapy. So they step you down to try a different drug. If it doesn't work or you have a reaction, they'll step you up. So formulary exception, tier exception, step therapy, and also the other thing that it's important to know about drug plans, and this also applies to advantage plans, is drug plans and advantage plans are area specific, meaning we write the plan according to the county that you live in. Okay. So if you should ever move, this is really important. If you should ever move out of that county, you should always call your agent. Don't call the insurance company, okay? Because they're going to put you in whatever's in your portfolio, right? Okay, but call your insurance agent so they can research all the plans that are available to you in your new service area. So if you ever move, I'm going to say this again, if you ever move out of your county or out of your state, you need to have your Medicare Advantage reviewed and your drug plan reviewed to make sure that you're still in that service area. Because as goofy as this sounds, did you know that there are plans specific for people that live in Cherokee County, Cobb County, Gwinnett, Henry? So if you lived in, say, Cobb County and you move to Fulton County, the plan that you're on there may be a plan that is Cobb County specific. And you move to Fulton County and you're out of your service area. So always, when you move either to the next county or to a different state, have your plan reviewed. I know, Celeste, you're going, oh God, this is getting confusing.
Well, no, I mean, since we're talking about drug prescription and stuff, the other thing that I have learned turning 65 is when I turned 65 and we have our own insurance because my husband still works. When don't trust your local pharmacist and the young child or young teenager, young adult working behind the counter, because I went to pick up the prescription and because it was right in my birthday month where I turned 65. Oh, because you're on Medicare now, this coupon is no longer good. And so it's going to be this much money and your insurance company only pays this much money. And it's like,
that is true.
Okay, well, and I went right up in here into Kentucky because we live part-time in Kentucky. Mm-hmm. And because we have that coupon thing or whatever, it was still just $3 and it never changed, not one time. But down there, and then it went back there. When I went back there, they went back to $3 for it, and it's name brand. And
okay. That does sound like somebody made an error because, but please note, there's so many medications that those coupons are not good whenever you're on a Medicare plan. Now, you guys are still on your husband's plan, okay?
That's right.
So I don't know how it affects because individual agents like myself, we cannot get involved in like a retiree plan or somebody who works for the railroad or the federal government. Okay, you have to call benefits and find out. But I do know on individual plans, there are many of those coupons. As a matter of fact, most of those coupons are not applicable to Medicare eligible. But it does sound like that guy made an error.
No, they did. And that's what I'm saying. And you think of an elderly person, they don't know. And it's like, oh no, I'm not paying that. I'm paying my $3. Okay. And so,
I'm gonna
you're wrong. You're wrong. But, but so many people just take these people at their word. And of course, after we researched, no, he was wrong. And so, I still, I'm paying the $3 for a name brand medication for my cholesterol. It's Crestor, but
right.
You have to do your due diligence. You have to be an advocate for yourself.
Yes.
And you just don't take one person's word. If you're doing this and they want to change it to this, just don't accept somebody that they're doing that. You need to understand why they're doing that and do your due diligence and do your research until you get comfortable with the right answer. And the right answer was you were wrong and I was right. And, and that's that. But a lot of people wouldn't do that. They would just like suck it up and do whatever they're told to do.
You just reminded me of something that I think is important for people to know. So, and I'll tell you, my sister, God rest her soul, because she has passed, she was the world's worst at this. She always believed if she received a bill, she had to write a check, put it in an envelope, stamp on it, and drive it to the post office that afternoon. Okay. Let me tell you, for people who are on Medicare, do not do that, okay? Because when you get a service done, okay, that provider sends it to their department. Then accounting department sends a part of it to Medicare, so Medicare can pay their part. They send it to your plan, so your plan can pay their part. Well, depending on how things get posted, whether it's with the provider or with Medicare or with the insurance company, that's not going to happen overnight. Okay. So when you get a bill, and most of the times, the first thing you get, it'll say, this is not a bill, even though it'll have all the charges listed on there. Don't pay it. I tell everybody, don't pay anything for about 2 months. Make sure Medicare's paid their part. Make sure the insurance company has paid their part, and make sure you pay your copay, not the full cost of the drug. I mean, I have this guy right now. Let me see if I can find my note. It doesn't. Anyway, this guy had some cancer treatments, and he called me last week all fuzzed up. He was like, oh my God, I'm being charged $5,000 something for this chemo treatment that I've had. And I said, don't pay it. He's like, what do you mean don't pay it? I said, when did you have it done? You know, he only had it done like a week or two ago. It's just the provider, okay, they got that bill to him in the mail really quickly. Well, I mean, you know, Medicare and the insurance company don't even know about it right now. So this poor guy, bless his sweetheart, he's just as sweet as pie. He's over there having a nervous breakdown, you know, going, I've got cancer. I got so many things going sideways in my life right now. It's like, no, I'm sure once Medicare pays and once the insurance company pays, that $5,000 is going to really decrease. So for everybody who's listening to this, please, when you get a bill, number one, don't freak out, because remember what I said, it's always Medicare's negotiated rate. It's not going to be the price that you see, okay, that you have to pay. So, but the providers send out the full cost of it, which does scare the bejesus out of you. And wait a month or two, make sure the insurance company is paid, make sure Medicare has paid. So you're just paying your copay or your co-insurance. And thank you for allowing me to go down that rabbit hole.
Oh. All right, Sarah, reel us back in, Sarah.
Okay. So we've got these things called A, B, C, D, you know, all these different plans.
Yeah, the alphabet soup.
Yeah. What is all that?
Okay. So I'm so glad that you asked that. So Medicare has Part A, B, C, and D. If you look on your Medicare card, that's the white card with the red and blue stripe, beside Part A says hospital, okay? And beside Part B says medical. So Part A and Part B is considered original Medicare, and it pays 80%. So Part A says hospital, but it covers hospital, it covers rehab or skilled nursing, and it also covers hospice. So Part A, even though it says hospital, it covers you when you're sick in the bed, because you're sick in the bed if you're in the hospital or nursing home or hospice. Part B covers a whole lot of territory, okay? Part B covers your doctor services, and doctor supplies. So, Sarah, when you went to the doctor, what did you need, sweetie? Did you need a Band-Aid? Did you need a stitch? Did you need joint replacement? Did you need brain surgery? After this meeting, you may need like one. But so it will pay for your doctor to perform the stitch or put the joint replacement in or to do the back surgery. And it'll pay for all of the supplies, you know, like the joint, I mean, like if you needed a new knee joint or whatever. Okay. So that's one of the things that the Part B medical pays for. The other thing it pays for is test. Well, did you break your finger and you needed an x-ray Or do you have a cyst growing somewhere and you need an MRI? Or do you need a CAT scan? Do you need to have something biopsied? So all of the tests, that falls under medical, under Part B also. Physical therapies, all of your therapies, your durable medical equipment. Do you need a walker or oxygen or wheelchair? So as you can see, there is a lot of things that fall under Part B. So it's your doctor services and supplies. And it doesn't matter whether you're in or out of the hospital or in outpatient, okay? It's going to cover your doctor services and supplies, all of your tests, home health care, which I think I forgot to say that earlier, your physical therapies, and your durable medical equipment. So once again, Part A and B is considered original Medicare. Part A is hospital, Part B is medical, okay? And it pays 80%. Part C is just another word for a Medicare Advantage plan. And a Medicare Advantage plan is one of two ways to get coverage to offset those costs. Because remember I said Part A and B, original Medicare, only pays 80%. And that leaves you owing the Part A deductible, the Part B deductible, and that other 20%. So a Medicare Advantage plan, Part C, is one of two ways to get coverage to offset that. And then Part D is the only one that makes any sense to anybody. And of course, that's for prescription drugs. And that gives us a point of reference we can all identify with. So Part A, hospital, Part B, medical, Part C is another word for Medicare Advantage plan, and Part D is a drug plan.
Very good. Thank you. So we're getting about 8 minutes before we come to the close of our show, Bonnie. So what are the advantages you provide to clients as a broker versus individual agents? And how is it that you can offer your services for free? And then my second part of that is do you have any kind of call to action for our listeners today?
Yeah, sure. So the way a brokerage works, or the way my brokerage works, is we are contracted with all the major carriers, plus some you've probably never heard of before, and they pay us a standardized commission. Now, it does not affect your cost one way or the other. This is just an additional commission that the insurance companies pay, and actually the federal government pays the insurance company. They really don't want y'all calling Medicare and Social Security, okay? They really want you guys to call us. That's the reason why the federal government pays the insurance company and they pay us. But it is a standardized commission. So we don't have any incentive to put you on this plan or with this company versus this or that, okay? We always come from a place of integrity. I just want everybody to know that. Our whole goal, Celeste, is to make sure that we do the best that we can and research every plan that's available to you, because I want you to feel comfortable if you need to refer your sister or your neighbor, or somebody that you love, that you can say, if I send somebody to Medicare and other red tape, they're going to do the right thing. And they're going to put that person in the best plan for their needs always. Okay. So that's where I come from. I also have a dozen or more agents, and we're in several different states other than just Georgia. So if you guys have, family or friends in other states and you're looking for somebody that can review their plan, then we would be more than happy to do it. Now, this is the time of year when everybody needs to have their plan reviewed and compared to what's coming down the pike for next year. Okay, so if you're on the best plan for you based on all of your criteria, okay, then I simply say you need to stay where you are. And if you do nothing, your plan will just roll over. You don't have to call anybody or write or text or do anything. Okay, your plans will just roll right over. And I've had people say, but I want you to be my agent. It was like, I want your business. I would love to be your agent. But if you're already on the best plan for you, sweetie, I'm going to tell you the honest truth. Okay. And so but that's not the way our services are free. So the insurance company pays us a standardized commission. And then everybody's call to action. Annual enrollment is from October the 15th until December the 7th. During this time, you can switch, compare your Medicare Advantage or your drug plan. Okay, so if you're unhappy with the plan you're on for whatever reason, maybe your doctor is no longer in the network, maybe your medications have changed, maybe you just want to see if, if there's something better that has some more benefits, the dental, vision, and hearing. We're not going to send anybody to Disney, but it is a good idea. You got to admit, it is a good idea, right? But anyway, this is the time of year you can do this. Now, listen closely. For those who are on Medicare Advantage plans only, okay? So if you're on a Medicare Advantage plan, listen up. If you're on the other ones, you can go ahead and take a nap. But if you're on a Medicare Advantage plan, there is another enrollment period called open enrollment from January the 1st until March the 31st. So if you are on an Advantage plan and you take it for a test drive the first part of the year and find out that maybe your needs have changed or it's just not quite the plan you thought it was, you have a one-time opportunity to switch plans. So should that happen, but remember that's for Medicare Advantage plans only, that January 1 to March 31st. And then call our office. My number is 770-373-7541. We'll be more than happy to research and compare your plans. You can go to the website, Medicare and Other Red Tape, or if that's too long, I did recently change it to also bonniedobbs.com. Will take you to the same, place.
Well, very good. I mean, we're down to about 4 minutes. So it's bonniedobbs.com or Medicare and Other Red Tape.com. Is that right?
That's it. Yes.
And your phone number one more time, Bonnie, please.
It's 770-373-7541.
And
I'm sorry, I do have an 800 number if people are out of state. I just quit using it basically. I can't find the 800 number. I shouldn't have brought that up, should I? But anyway, if you still have just a rotary phone, you can get somebody with a cell phone to call us and we'll give you our 800 number.
Well, Bonnie, it's always a pleasure and a delight on behalf of Sara and I and the WCEG Talk Network to have you come and talk to our audience and our listeners. You are a wealth of knowledge. You just gave a mountain of gold nuggets to our audience today. And we just thank you so much. And we would like for our audience and listeners to take advantage and reach out to Bonnie Dobbs at Medicare and Other Red Tape.com and have a complimentary call with her to see what, during this time, because we have from October 15th till December 7th for this open enrollment, correct?
Yes, annual enrollment is right now.
And we had one last question, and we only have 2 minutes, Bonnie, is once on Medicare, are you always on Medicare, or do you have to recertify?
No, once you have started your Part A and your Part B, you're always on it. If you don't pay your Part B and disenroll, you will get a penalty, and penalties are for life. If you're on Part A and Part B, you also have to get a drug plan. Otherwise, you get a penalty, and a penalty is for life. So once you're Medicare eligible, don't ever disenroll. And if you move, give us a call to make sure that that your plan is still available in your new service area. If you have any questions, you can always just give us a call. We'll be happy to help you.
Absolutely. And again, thank you so much, Bonnie, for being our guest. You are the queen of Medicare and Other Red Tape. and Sara, I'm so glad to see you and have you as a host as always. And we're all going to watch the Braves tonight take the game. So again, we want to thank Penny Rogers and our board and everybody at WCEG for this opportunity to serve our WCEG Talk community. It's a privilege and honor on our behalf. And Bonnie, our heart just loves your heart.
Oh, thank you. I love you, Celeste.
Yeah,
and
we
thank
love you
also,
too.
Sarah.
And Sarah, I love you.
There you go.
All right. You guys have a blessed evening. Let's go Braves.
Go
There you
Braves.
go. Go
Okay.
Braves.
All
Bye-bye.
right.
Thanks,
Bye-bye.
everybody. Bye.